Dear friends, I am Dr. Shyam K Jaiswal. I am the consultant neurophysician. I am working in the care hospital Banjara Hills almost a decade. I'm just going to talk about the headache, especially the migraine today, because the headache and migraine is the one of the commonest neurology disorders. You can say it is the most common problem patients coming in the outpatients, and it causes the what is it called daily loss. Daily loss means daily activating living loss. The patients who having suffering from headache and migraine, they cannot work because nowadays lots of people are working on the systems, computer. This COVID time they have to work on the iPads, computer, laptop, and this screen causes lots of the headache and migraine issues also, and because of the irregular lifestyle habit also. So I just want to talk about the migraine headache so that you can understand how we can manage that. So migraine is mostly because of the irregular lifestyles and something called the irregular hormonal changes in the body. Mostly we see in the girls and the ladies because of the different hormonal issues in the females, and it could be because of the irregular lifestyles where they keep on continuously sitting on the screens and working on the video games, playing on the TV, and like that. So for the prevention of migraine, we have to have good lifestyles. We have the proper lifestyles. First, we should have proper food on times. You should never skip your meals like breakfast, lunch, and dinner. Try to avoid the very spicy foods and the junk foods because the junk foods containing many preservatives which can trigger the migraines. Then we have to avoid the caffeine. Lots of caffeine like tea, coffee, even the cokes and cold drink can trigger the migraine. Then alcohols and smoking, all those things are triggers on migraine. So we should avoid those things when suffering from the migraine headache for the long time. And then definitely we have to sleep on times, and we have to adequate sleep, at least 7 to 8 hours sleeps depending on the age, and minimum of 7 hours definitely needed. And we should avoid the late night sleeps and late night get ups. So late night wakefulness, better to sleep by the 10, 11 and get up by 6 in the morning. And one very important thing that is called sleep hygiene. This sleep hygiene is very important. It means that there should be no screen, including the mobiles, iPad, TV in the bedrooms. It should be dark, peaceful things. People can listen to a little bit music and read books if light books and read and go to sleep. And other important thing is called the exercises, mainly the breathing exercises and yoga exercises, which helps in the decreasing the headache. So these things are very important. The regular lifestyles, having food on time, regular sleeps on times, then avoid the screenings and avoiding the food like the junk foods, caffeine, all those things, and taking lots of fresh fruit, fruits and vegetables. So these are the preventive measures. And despite all those things, the patient is not still suffering from the headache, they should consult the neurophysician or headache specialist. And there's something called preventive medications are there. These preventive medications, if they're taken for 1 to 3 months, this headache can be controlled. And because of the recent medical advances, we have lots of medications where the patient will not have lots of side effects also because of medications. They become one of the problem with the migraine patient. They have lots of weight. This obesity also one of the risk factor for the headache. But these medications can help in the weight issues also. So these advances are coming down now. Recently, one injections has been launched that was there in the Western countries since long time. But recently, 2 months back, this injection has been launched, and this injection just once in a month. And with this injections also, the migraine can be controlled. So these kind of things, with the proper lifestyles and proper medications and proper care, this headache issue and the migraine issue can be controlled properly. Thank you very much. I just wanted to tell about a few words about this channel, the Doctor's Advice channels, which has been launched since last 1 year, and it covers both the Telugu states, Andhra and Telangana. They're based in Hyderabad. Actually, this channel I find is very, very informative and useful because it just for the educations, the awareness, and about the giving the good information to the general publics, and it's take care of all the doctors, all the specialist doctors, neurology, nephrology, cardiology, endocrinologist, liver specialist, gastroenterologist. They take care of all the doctors, and they take their suggestions and opinions for the patients' educations, about awareness, about the health educations to all around us about the Telugu states. So I'll definitely recommend you people regularly watch these channels where there's all specialists speaking about the different diseases and educating the people about the awareness about the different diseases in the all around those cities for the common public, so that their health and the life improves. Thank you very much.
We'll be covering all topics which commonly affect patients on a day-to-day basis.
For more this type of doctor advices or opinion or any other things,
దయచేసి డాక్టర్స్ అడ్వైస్ ఛానల్
లైక్ చేయండి, కామెంట్ చేయండి, షేర్ చేయండి.
సబ్స్క్రైబ్
to this channel, Doctor's Advice.
10 మందికి ఉపయోగపడేలాగా చూడండి. థ్యాంక్ యూ సో మచ్.